Most of us do not know that there is one section of the lab which is almost completely manual, and which means that your cancers, biopsies will need to be reviewed under a microscope. Blood cancers, your tissue biopsies, infections, malarial parasites, different types of anemias, urinary tract infections, pap smears, all these things are done manually in more than 95% of labs across the world. And that is not just in the emerging market, but also in the developed market. So what we do is basically we try to automate that process with the help of robotics and AI. And since the AI has done, I would say 90-95% of the job of the pathologist, then the review time per sample comes down drastically. And which means that the same pathologist who can probably look at 20, 30 samples a day can look at 200 samples in a day without getting tired.
Lack of blood and urine diagnostics presents a significant global health issue, especially in developing countries and underserved areas. Women, children, and the elderly in particular are most vulnerable to this problem. Oftentimes, the lack of diagnostics can make a disease more severe, leading to hospitalization and a strain on the healthcare resources. My name is Arun, and you are with the AI with Arun show. To understand how robotics and AI can help address this very issue, we are joined by a very special guest today, Dr. Tathagato Rai Dastidar, who is the founder and CEO of SigTuple, which is a pioneering MedTech company revolutionizing the way microscopic analysis of biological samples through AI, robotics, and data science. Dr. Dastidar is an alumni of IIT Kharagpur and a B.Tech and a Ph.D in computer science. He holds 11 US patents in research areas spanning across AI, computer vision, and image processing. Most significantly, the company raised 33 crores Indian rupees or 4 million US dollars. Tata, welcome to the show.
Thank you, Arun. Thanks for having me on the show, and thank you very much for the kind introduction.
Of course. So, Zaga, let's jump in, Tata. So, your mission as a company is to democratize microscopy and make quality healthcare accessible globally. And this is truly inspiring, Tata. So share with our viewers some specific examples of how your technology is already making a difference in underserved areas.
Right. So before I go into that, Arun, I would just like to probably briefly touch upon what exactly that we do, then probably how we are doing, I mean, where we are serving, that will make more sense. So if you say, I mean, let's take diagnostics. I'm sure most of us would have seen a diagnostic lab, been to a diagnostic lab to get ourselves tested and all. So you'll see that most of the processes in a diagnostic lab are automated. So what the hell am I doing trying to automate further? But most of us do not know that there is one section of the lab which is almost completely manual. And that section is where a pathologist or a medical technologist will sit at a desk using a microscope, look at samples to diagnose diseases. And unfortunately, even in this 21st century, that process remains the gold standard for the critical disease diagnostics, which means that your cancers, biopsies will need to be reviewed under a microscope. Blood cancers, your tissue biopsies, infections, malarial parasites, different types of anemias, urinary tract infections, pap smears, all these things are done manually in more than 95% of labs across the world. And that is not just in the emerging market, but also in the developed market. So what we do is basically we try to automate that process with the help of robotics and AI. So the product is I would say an integrated hardware and software solution. The hardware is an automated robotic AI-driven microscope, which can take a physical sample and automatically convert it into a multitude of microscopic digital images. And then there is AI, which will analyze those images and mimic what the pathologist or the medical technologist would have done by examining the sample with the help of microscope. It will identify the different types of cells, the tissues, what is normal, what is not abnormal, and so on, and then present the result to the pathologist or the medical technologist on a computer screen, potentially anywhere in the world. which basically helps the pathologist review samples remotely, which means that even if the sample is coming from is and the machine is in a remote area and the pathologist is in a big city, they can actually review that sample and give a diagnosis. And since the AI has done, I would say 90-95% of the job of the pathologist, then the review time per sample comes down drastically. And which means that the same pathologist who can probably look at 20, 30 samples a day can look at 200 samples in a day without getting tired. And obviously, with AI, AI does not get tired. AI does not depend what I had for breakfast. So it makes fewer mistakes, fatigue-related mistakes. It does not have inter-observer variability and so on. So ultimately, we can get better diagnosis, especially for those rarer abnormalities, and thereby provide a better patient outcome. Now, how this is helping today? So we are in right now in India and in a few other countries, including North Africa, Middle East, Southeast Asia, and so on. In India, we have one particular customer who closely works with the government and sets up laboratories in remote areas. And one of the states that they operate in is the Himachal Pradesh. And there are government labs over there which are in such areas which are even not even accessible in winter because of the snow. So they actually have one of our machines in each of their labs. And they do not have pathologists in these remote areas. They actually have pathologists in central locations, maybe in Shimla, maybe in Chandigarh and whatever. And they actually report on samples from all these 30 odd labs across Himachal Pradesh from one or two centers. And they have replicated the same model in Orissa, in Assam, and we are now thinking of going to Rajasthan as well. So, and if you see who are the people who are coming to these labs, these are government run hospitals, government run labs. It is basically the people from the lowest rung of the economic strata who come there, and for whom getting an early diagnosis, meaning that they can get their medication on the same day after seeing the doctor, and they do not have to come back the next day to get their reports and get their medicines, which basically means for many of them a day's wage saved, because if you don't work you don't get paid in that straight out society. So this, I would say, is one of the biggest I would say things which inspire us as a company, that we are actually making quality diagnostics available to people who have so far not have had access to it.
Yeah. So that's such a wonderful inspiration. So, I mean, a lot of time we speak about, how do we build products for people at the bottom of the pyramid, right? Where there is hardly any dollar value associated with it, or very less dollar value associated with it.
Yeah.
So, what you are saying and what you are doing, the product that you have, is exactly targets people in that bracket.
Like
And
not only that, Arun, we actually target people across the spectrum. I just pointed it out as an example, but
yeah,
we also have customers who are the largest cancer chains in India.
wow,
So we are actually serving the uh, highest end of the spectrum as well. So we
wow.
are serving
So,
it. So the
mhm.
problem is universal. I mean, lack of doctors is a universal problem, and it is across the economic spectrum, across geographies. Lack of pathologists is a common problem, and we are trying to solve for that.
Yeah. So that's a wonderful problem statement to solve, Tada, and this is fantastic how you're able to bring in newer technologies to address the wide spectrum, right? So you're right. I mean, I stand corrected. It's not just that part of the section, right? It's across the board. That's wonderful. Let's talk to our viewers about some of the technology, uh, or actually take a step back, Tada, and talk to viewers about how did this idea actually come to your mind?
Okay, so I can't claim credit for that actually. So back in 2015, I was in between jobs and thinking of doing something on my own. And due to my previous jobs, I had some solid background in machine learning, analytics, and then deep learning was just coming up in those days. I kind of dabbled my fingers into that as well. And Jensen Huang was kind of singing peons to CNNs and how this can change the world and all that. So I got inspired, and I was in the hunt for a use case to which we can apply AI. We intuitively understood that okay, AI can solve a lot of human level tasks, which has been kind of hitherto impossible. But what is the use case? I had a preference for doing something which actually has a positive impact on society, not just doing something for say for the sake of it, or building an app, or kind of doing fashion, food, and all that. So healthcare came up as an idea, and intuitively, all of us understand that healthcare generates a lot of data, right? And we also know that most of that data is never used. So what we thought is basically that, okay, if we can put that data to use, maybe we can actually make life simpler for doctors or provide positive value to patients and so on. But being from, I mean, you and I come from the same institute, we have zero medical background. We obviously didn't know where to start, right? Uh, Fortunately for us, we got connected with a few visionary doctors here in Bangalore, and some of them were pathologists. One of them was a director of the one of the largest and oldest pathology labs in Bangalore, and that gentleman was a fanatic about technology. So is rather I wouldn't say was is a fanatic about technology. So he says that I have to bring value to the patient through technology, and technology is the only way we can bring value in a diagnostic lab setup. So he has probably spent millions into automating every bit of his lab, right from sample collection to barcoding to sample movement different between different machines, everything error-free, automated, so that the chances of errors go down and patients get better. But he said, okay, the same statement that I said right in the beginning is that, you see, there's this section of my lab which is completely unautomated. And this is usually my reporting bottleneck because the machine gives out the result in half an hour. I have to wait half a day next for the pathologist to review the sample in case of abnormal samples and get the report back. So can you help automate that? So that's how we got started. We obviously uh, got into, we thought we will just be an AI company first, but we quickly realized that AI needs data to run on. And in case of pathology, the data is the physical glass slide with the sample on it. There is no machine which today automatically converts it into digital images. So we had to end up building the hardware as well. And today we pride ourselves as being a robotics plus AI company rather than an AI company. So that's how it started.
That's a good one, Dada. You are combining multiple technologies
Yes.
in this case, right? So it's a combination of hardware and software that
Yep.
yeah.
And hardware, not just your robotics, but we obviously have mechanical, electronics, optics, and all that. But we also have a separate section group in our company which deals with biochemistry and microfluidics. So the microfluidics is basically with the idea of simplifying sample preparation, reagent mixing, and everything so that diagnostics can be taken to the point of care. So we have stalwarts in microfluidics, in optics, in mechanical engineering, in software, in AI, all under one roof.
It's the whole 9 yards.
Yeah, it's the whole 9 yards.
Wonderful. So what about the manufacturing of the hardware that you have? The software is something that it's probably in-house. All of
Yes.
your build. What about the hardware?
The hardware design is entirely in-house. Every bit of it, every screw. We typically procure the components from elsewhere, both inside India and outside India, and then we assemble it ourselves. We have a small manufacturing facility in house, but that is something which we do plan to kind of outsource the assembly part of it going forward to a contract manufacturer.
Wonderful, wonderful. Tata, walk our viewers into as much detail as we can publicly share about
Hmm.
some of the underlying technology that you're using. So at a high level, we understand that, right? It's a combination of robotics, it's AI,
Right.
right? Machine learning involved, there's computer vision involved. So just walk our viewers through some of the underlying technology that you use and how they interplay with each other.
Sure. So one of the reasons actually why this field has so few players is because it is a very interdisciplinary field. You cannot be just a software company or just a hardware company in order to build this. So the way the process works is that it starts with a glass slide which has a sample on it, right? And which needs to be imaged with the help of a microscopic lens. So the lens sits inside the device. There is a robotic arm which comes out. You can place one slide, or in our upcoming device, there are 6 samples at a time. Then this robotic arm takes the sample under the lens, okay? And then the sample moves around under the lens, and a large area of the sample is imaged. Just to give you an example, one image through the microscopic lens, depending on the, say, if it's a 40x lens, will give you approximately a 500 half a millimeter diameter circle. So if you have to image, say, maybe 15 millimeters cross 15 millimeter area, you have to take hundreds of images, actually thousands of images, right? So that's what the robotic arm does. And at each point, there is a focusing involved. So the lens has a depth of focus. The microscopic lens has a depth of focus which is in the range of microns. So you need to adjust the distance between the sample and the lens at each step in order to bring it into focus. There is a lot of AI involved in that focusing algorithm as well. And while theoretically it sounds simple that, okay, there is a robotic arm just moving around like this under a lens, but we are talking about micron level precision. So the movement precisions have to be at the order of microns. And any mechanical system which has that kind of requirement becomes inherently complex, right? So that is, and this process of capturing the images of the sample, and before that identifying which areas of the sample are of interest, then capturing images, that entire thing is driven by advanced AI and image processing. Then once the images are there, these are basically run through a multitude of models, uh, AI models, which pick out things of interest. So in case of, say, if I'm doing blood microscopy, I need to pick out which are the red blood cells, the white blood cells, the platelets. And then there are classification models which will say, okay, what type of white blood cells are there, which are normal, which are the normal types, which are the abnormal types. Then a host of statistical calculations, and what is the differential count, and so on. And finally, everything is shown to the reviewer, the pathologist, on a web browser. And everything that the AI says is actually backed up by visual evidence. So it's not a black box AI, it's a completely white box AI, so to say. So if the AI says that, okay, this sample might be infected with malaria, there will be images of the cells infected with that parasite. If it says that, okay, this is a possible case of leukemia, it will show the immature white blood cells, which are kind of indicative of leukemia, and so on. So that increases the confidence of the pathologist in signing off on a sample without having physical access to it. That, in a nutshell, is the technology. Obviously, I oversimplified it, but
Right. No, but this does give a fair view, at least a high level, right? And people who are interested, I'll share the link of website so people can actually go in and see more details. But that certainly gives a fair view. So Dada, in terms of the logistics by itself, right? So let's say I'm in a very remote area where I don't have access to a pathologist, and there is a center of yours where this is hardware placed, right? So how is that center? So is that, for example, like a small office or something, or how is that?
no, we basically sell our equipment to the laboratories themselves. So it's a remote area. There's a laboratory. We place the device over there, and there is a technician. Every laboratory has a technician who can take the blood sample, prepare the slide, and then scan it with our machine. And then the pathologist sitting in a remote area, I mean, sitting in a say tier 1 city or a tier 2 city, can actually review that sample. That's right.
Understood. So every remote area probably had just maybe one or two technicians whose
Yeah.
job is to sort of do the sample
Right.
collection, right? From
Right.
the good part is the people who are there wherever they are, they don't have to travel a long distance just to do a test run.
Right. Exactly.
Yeah, wonderful. Tata, see, talk to our viewers about some of the initial motivations that you had when you set up this, right? I know that there's a personal story involved, right, in terms of your own dad being, misdiagnosed, right? So talk to our viewers about, how, what kind of impact that had, this personal
Right.
story had in your own life, and how that encouraged you to be where you are today.
Okay. While you see that happened a very long time ago, and while this was playing, it always was at the back of my mind. I was not specifically thinking of this particular use case when I started thinking of SigTuple. But as I mentioned earlier, we were kind of guided by a few visionary doctors, and when they mentioned blood microscopy, the question that came to my mind is that can this help in diagnosing or early detection of blood cancers? And the answer was yes. And that kind of obviously gave us an additional boost to uh, grab this with both the hands, so to say.
Got it. Got it. So talk to our viewers about some of the future roadmap that you have, both from a product roadmap perspective as well as from a technology and AI machine learning standpoint. What have you been thinking more about in the future?
Yeah. So one thing that I keep getting asked is basically when are you going to use generative AI in your Gen AI and in your products? My standard my standard answer is probably never. Uh, at least as of now, I don't have visibility into it. But what we are really focusing on is microfluidics from the technology point of view. So basically, how do we uh, uh, make it possible to do complex tests with a single drop of blood? And this is a story which has received a lot of limelight and not always for the good reasons, a lot of fraud and everything. But today the technology exists. But the problem still remains is that the cost of that technology is sufficiently high for it to be not widely being accepted. I mean, even in, say, developed economies, there is always this cost of insurance because the insurance needs to approve the cost of doing a test at a point of care setting compared to doing it in a lab. And unless the prices are comparable, the insurance is not going to pay for it. So worldwide, what companies are struggling with today in terms of point of care diagnostics is basically how do I make the test available at a price point which is similar to the price point of the same test done in a proper diagnostic laboratory. So we believe that we are able to solve that problem. And microfluidics is one of the vehicles of that solution. So microfluidics deals with the science of handling very small quantities of liquid. So the idea here is that basically take a drop of blood, maybe from a finger prick, and then have the blood go into a microfluidic cartridge, which does all the sample preparation and makes it ready for analysis. And then we are trying to miniaturize our hardware, which can basically sit at a doctor's chamber or at a PHC, which will take in that blood inside that microfluidic cartridge, then use optics and imaging and AI to uh, analyze the sample and then spit out a report in a matter of minutes. So we are basically trying to take this technology closer and closer to the patients. And I think we have hit quite a few milestones recently, and I'm hopeful of bringing that product to the market sometime in the first half of next year.
Oh wow,
And
so you're that close.
yes, yeah, we are that close actually. And at a price point which will be affordable, at least initially to start with in the developed markets and eventually even in developing markets.
Oh, that's fantastic, though. That's fantastic.
That's one. And we also have this other product which was just right now beta released last month. This is, I would say, an upgraded version of a current device for digital pathology. It has better throughput, better optics quality, better wider range of samples that can be tested on it, and so on. And so this is basically the stakes. And today we believe that, okay, with the kind of expertise that we have in terms of AI, building AI, we have uh, our focus. AI by itself will not yield much further value. We have to build the value by basically building the systems, the end-to-end systems of which AI is also a part, which basically means that the hardware needs to be world class, the optics needs to be absolutely of the highest quality, the images should be talking to the pathologist, and so on. And then AI comes as an added layer on top of it.
Right, right. Yeah. Yeah. And certainly, I mean, this is all about solving the core problem that you want to solve, right?
Yes,
Which is about the diagnostics and everything that
yes,
you do, be it around the fluid dynamics, be it about the hardware by itself, or be it about the AI or
right,
robotics. They're all part of the solution rather than being the focus.
correct.
Yeah. So I have two questions around this. So one was around the costing aspect of it, right?
Hmm,
And the other one is about the insurance. You sort of touched upon the insurance,
hmm.
but talk to our viewers about how does insurance work today, especially some of the things you talked about, like cancer, for example, right? So I can safely assume that people in some part of the world may not have access to insurance, right? But there are
Hmm.
many other people, and you sort of cater to them as well, especially on cancer or some of the other diseases, leukemia, others, which are economy strata agnostic. So how
Hmm.
does insurance work in those cases?
So insurance usually pays for the lab tests. And today, the lab actually is saving money by using our device because uh, they can handle more samples with the same number of pathologists. I'm talking about a high-end lab which is doing cancer diagnostics because the AI and the digital images are making the pathologist more efficient. So the ROI happens through that for the lab. And that is true in India, that would be true in US or anywhere else. In US, obviously, there are reimbursement codes for, say, pathologist slide review.
Right.
There may or may not be specific codes for digital pathology, but with digital pathology, you can have the same pathologist look at many more samples than what is possible today. So
Yeah.
that's how the lab kind of gets the ROI for their investment in the technology.
Right. So that certainly takes care of the insurance, and maybe in future they probably may have a new code
Yep,
for digital, right, rather than yeah
that is
what.
probably in the offing. It is in the offing. FDA, I believe, is working on that. FDA and all these.
Right, wonderful. And how do your customers, the hospitals or the chains, right, or the government entities, how do they have get access? How do you monetize it?
Pardon?
How do you monetize your product?
Yeah. So we sell the hardware. We sell the hardware and we sell the service for the cloud and the AI and everything. So it's a
Okay,
basically fixed plus recurring model,
understood.
upfront plus recurring model.
Got it. Got it. Got it. So, so that's like a great business, even from a stakeholder perspective, right? Even if I'm
Hmm.
looking at your company just from a financial standpoint,
Hmm.
it's not just a one-time sale that happens, but there is the constant annual recurring revenue sort of model that
Yes.
you
Yes.
have, the managed services model that you have.
Right.
Understood. So that's wonderful. We spoke about what you're doing now, and we spoke a little bit about the future. We'll move on to the the third part, or the final part of our show, which is called the rapid fire round.
Okay.
All right. So here's my first question: ChatGPT or Google Gemini or Meta Llama? If you could use one for the rest of your life, what would it be?
I would say neither. I would
None
say
of them.
none of them. Yes, because I am not happy. You see, my questions are usually typically deep or technical in nature, which I pose to them. And the deeper the question you ask, the more nonsensical the answers become.
That's right. That's right.
Google
And that
search still Google search still works better than most of the answers that I get over there.
yeah, because there's probably not been trained in that kind of the data kind of data that you're looking at.
Exactly. Exactly.
Yeah.
If I'm planning a trip, maybe I'll just toss a coin and choose one of them. Okay, which are the cities and the uh, places that I need to visit?
Uh, so that possibly mean that we need an LLM specifically for the kind of thing that you're looking at, right?
No, I think we need to have LLMs which are more scientific,
Yes.
I mean, not necessarily in my field, but I'm sure you'll get a similar answer from anybody who's trying to do technical or scientific queries into ChatGPT.
Right.
So,
And so probably that's a discussion for the other day, but maybe that's a lot of IP that could come in, right? For example,
mm,
if I'm a researcher, I cannot make all of that IP public till the time
mm,
it's published.
mm,
So it may anyway not be very helpful from a response perspective. But I guess that's a discussion for another day.
yeah,
Yeah. All right. The second one that we have, that what is the most overrated AI trend right now?
I think I answered that question in the my
Yeah,
answer to
you
the
probably
previous question itself.
answered. Yeah.
AI generated images which look like dead. I mean, they're very vibrant, they're very colorful, but completely devoid of life.
Yeah. Yeah. All right. The third one that we have, in one sentence, define the future of AI in your field.
Uh, okay. AI will never replace a doctor, but a doctor using AI will very soon replace a doctor not using AI as a decision support system.
Very well said. Very well said. AI is such a huge enabler,
Yes,
especially in the kind of work that you're doing.
exactly. Unfortunately, that doesn't get too much of a limelight, and what instead we get is all this crap coming out of ChatGPT.
Right. Yeah, you're right. You're right. You're right. Yeah, we are focusing so much more on the enabling technology rather than the outcomes that it is driving. I mean,
Yes,
right.
right.
Okay. The fourth one, what is one AI skill that everyone should be learning today to be prepared for tomorrow?
Okay, if you're talking about a layperson, I would say the best skill to learn about AI is basically how to spot AI,
Hmm.
how to spot fakes generated by AI.
Yeah, yeah,
And
yeah.
if we are talking about a engineer who's building AI models, I think there is no alternative to hard work in learning how AI works from grounds up. Learning what is backpropagation, what is ReLU, and what is convolution, and all that. That I mean, when I interview people for jobs and everything, that is one skill that I see seriously lacking in many so-called good candidates.
Hmm.
Knowledge of basics. I think that it's very important. Call me old-fashioned.
Yeah, I know you're right. You're right. Those fundamentals actually help. Yeah. And then the last one I have, if AI could take over one of your daily tasks completely, what would it be?
Hmm. Good question. Probably, I would say managing my calendar.
Yeah, yeah, I'm pretty sure. Yeah, you're a busy man and a lot of stuff to take care.
Right.
Wonderful. Wonderful. So that was the last part. I have a few more questions before I let you go. A lot of time, viewers come to our channel to understand, what kind of skills are you looking at, especially from an employability standpoint. So, what
Hmm.
would be your guidance? You sort of touched upon, when you said this is what you look at from an interview standpoint. But
Hmm.
talk to our viewers a little bit more about some of the two things. One is the kind of openings that you typically look at, right? May not be immediate, but maybe in the future. One
Hmm.
and two, the kind of skills that you would, uh,
Hmm.
personality that you would like to have.
Right. So we have obviously openings on the engineering side, both for software engineering and AI engineering. And there, the skill set that I look for is a good coding skills, good debugging skills, and if it's an AI position, then good knowledge of basics. Those are the things that we look for. Then we have mechanical engineers and electronics engineers. We do look for such people. Usually, I don't take the interviews in this, those cases for obvious reasons. I don't have much of a background in those fields. But there also, I think the idea is similar, that look for basics, look for experience and knowledge of systems on what they've worked on. And similarly, microfluidics engineers and all that. And we also have doctors on board. So there we have a few senior doctors who test the knowledge, in-depth knowledge of uh, pathology of any new entrant that we bring in. And when it comes to product, I would say understanding of a product development life cycle and how to do requirements, how to basically do usability studies, how to do uh, literature survey about existing products in the market, how do you identify features, talking to customers. These kind of skills are what we look for in our product team.
Wonderful. That certainly gives a lot of good insights to our viewers. Any closing remarks from you, Tata?
Yeah. So let's talk about SigTuple's vision of the future. That maybe in 5 years, maybe in 10 years, we should not have people in laboratories peering through microscopes. They should be looking at AI assisted results on a digital screen.
Wonderful, Tata. And I'm pretty sure the progress that you're making, right, and to see that in the news, the kind of investment that you guys are getting, you are certainly on the right track.
Thank you, Arun.
Yeah, and good luck to you, Tata, for being able to achieve this vision. You're already on the way to it.
Many thanks for the kind words.
Yeah. Thank you, Tata. Thank you for your time today.